Good morning to all. Today we are going to discuss on anatomy of the female reproductive organ. So let us know first what all are included under the anatomy under the female reproductive organs. The organs are mainly divided into two: external and internal. External reproductive organs and internal reproductive organs. The external reproductive organs include the mons pubis, labia majora, labia minora, clitoris, vestibule or urethral orifice, vaginal orifice, then perineum. Then under the internal reproductive organs, these are the ovaries, uterus, cervix, and vagina. So the reproductive organs in the females are concerned with copulation, fertilization, growth and development of fetus, and childbirth. And the functions of female reproductive organ are, they will help in the female reproductive organs, what all functions they are going to do. They will do the oogenesis, okay, then copulation, hormone production, menstruation, and provide the sites for egg fertilization, implantation, and development. All this will take place under the female reproductive organs. It consists of the body, pelvis, and soft tissue, and the soft tissue consists of the external and the internal. The external female genital organs is also known as the vulva. So we have already known from the beginning that under the external genitalia, it includes the mons pubis. Okay, then next it is outermost area. Okay, mons. You can see in the structure also. The upper part is known as the mons pubis. Then next is the labia majora. Labia majora is the skin which is covering outermost skin. Okay, then inner to that is known as the labia minora. Then lies the clitoris, hymen, and the vestibular glands. So the mons pubis is a pad of fat covered with pubic hair from the time of puberty. Okay, so this is a fatty area where the pubic hair is there. Then its function is to protect the protection of the symphysis pubis during the intercourse. Okay, it will protect the area of the symphysis pubis. Okay, all the areas included under this external genitalia it will protect. Then its location is over the symphysis pubis. Next is the labia majora. Labia majora are two folds of fat and areolar tissue covered with skin and pubic hair on the outer surface. It contains sweat and sebaceous glands. Okay, so this is a two-fold fat covered with skin and pubic hair. Its function is to protect the vaginal introitus. Then its location is it arises in the mons veneris and merged into the perineum behind. Okay, then next is the labia minora. It is a smaller lips and two thin folds of hairless skin lying between the labia majora. Okay, inner to the labia majora, it will lie anteriorly, divide to enclose the clitoris, posteriorly fuse, forming the fourchette. Anterior in front of the labia minora lies the clitoris. Then behind lies the fourchette. Its function is to lubricate the vulva, swell in response to stimulation, and highly sensitive. Then location is it lies between the labia majora. Next is the clitoris. It is a small erectile organ and very sensitive and highly vascular, and its function is for the sexual stimulation, and location it is located at the anterior junction of the labia majora. Then labia minora. Then the vestibule, it is area in which openings of the urethra and vagina are situated and enclosed by the labia minora. Okay, so we can see in the picture also, the vestibule is the area in the openings of the urethra and the vagina. Then the urethral orifice, we know It is a 2.5 centimeter posterior to the clitoris. The skin's glands are located on either side of the opening to the urethra. They secrete a small amount of mucus to keep the opening moist and lubricated for the passage of urine, which are two small blind-ended tubules 0.5 centimeter long running within the urethral wall. So urethral orifice is nothing but the orifice on which urine will pass through. Then the vaginal orifice, this occupies the posterior 2/3 of the vestibule. The orifice is partially closed by the hymen. The hymen is a thin membrane which tears during the sexual intercourse or during the birth of the first child. It has one or more openings to allow the escape of the menstrual blood. Okay, the Bartholin's glands are also the two glands which are situated open on either side of the vaginal orifice. Its function is to secrete the mucus, producing copious amounts during the intercourse to act as the lubricant. Then the perineum body. The perineum is the most posterior part of the external female reproductive organs. This external region is located between the vulva and the anus. Okay, so in between the anus and the vulva is situated the perineal area. Okay, the perineum, also known as the perineum. It is the most posterior part of the external female reproductive organ. Okay, its function is to support the next is the internal female reproductive glands. The internal female reproductive glands contains of the vagina, uterus, 2 fallopian tubes and 2 ovaries. Let us first know the ovaries. The ovaries are also known as the female gonads, comparable to the testes in the male. Okay, in the female it will be the ovaries, then in the male it will be the testes, which will be producing the hormones. Okay, gonads, and similar to the amounts in size and shape. Each ovary weighs around 2 to 5 grams and is about 4 centimeter long, 2 centimeter wide and 1 centimeter thick. These are located on either side of the uterus, below and behind the fimbriated ends of the ova ducts. Okay, so these fimbri are these are the end parts of the fallopian tube. Okay, so we can see in the picture the middle part is known as the uterus. Okay, then the uterus extends on both sides with the fallopian tube. Then the fallopian tube extends through the finger-like substances are lying at the end of the fallopian tube. They are connected with the ovary on both the sides. Okay, then the functions of the ovary is the development and release of the ovum and secretion of hormones estrogen, progesterone and androgen. So this function is to produce. Then next is the medulla. This medulla are part of the ovary. Okay, medulla and cortex. Medulla is made of fibrous tissue, and the ovarian blood vessels, lymphatics and nerves travel to it. Then the cortex contains ovarian follicles in different stages of development, surrounded by the stroma. Then relations, like in the anterior portion of the ovary, that means in front, the broad ligaments will be lying. These are the ligaments. There will be various ligaments which will be lying around our internal, that means the uterus, around our uterus. Okay, so the broad ligaments will be lying anterior to the ovary. Then posterior to the ovary will lie our intestine. Then on the lateral side, on the side wall of the pelvis will be there. Then on superior means above the ovary lies a fallopian tube. Then medial means inner to the ovary lies the uterus and the ovarian ligaments. Then next is the fallopian tube or the uterine tubes. Okay, so it open passway extended from the cornea of the uterus towards the side walls of the pelvis. Its tube is 10 centimeter long. So this fallopian tube are also known as the uterine tube. So this will extend from the uterus towards the side of the pelvis. It is about 10 centimeter long each. In the interstitial portion, it is 1 centimeter long and lies within the wall of the uterus. Then these are the parts of the fallopian tube. Okay, so these are the parts of the fallopian tube. The parts of the fallopian tube are the interstitial portion, the isthmus, the ampulla, the infundibulum. Okay, then the fimbriae also there. Then first one is the infundibulum. It is a part which is connected. It is a junction which is connected with the uterus. Then the isthmus, you can see in the picture also, the isthmus. It will continue from the interstitial portion, then extends for 2 centimeter from the uterus. Then next lies the ampulla. It is a wider portion of the tube where fertilization usually occurs. So this ampulla is the region where the fertilization will be occurring. Then next lies the infundibulum. Infundibulum, these are the end portion which is 2 centimeter long in the funnel-shaped fringe end, which is composed of the fimbriae. So in this infundibulum will lie also the fimbriae, which are the finger-like objections. Okay, then one fimbriae is elongated to form the ovarian fibra, which is attached to the ovary. Okay, so this fimbriae will be attached to the ovary. Then the functions of the fallopian tube are: it will receive the spermatozoa as they travel upwards. Then it will provide the site for the fertilization, that means in the ampulla. Then this will transport the ovum and pick up. Then embryo transport and nourishment will be done here. So in the anterior and posterior will lie the peritoneal cavity, and the posterior will lie the intestines. Then the side lies the side walls of the pelvis. Then inferior to it lies the broad ligaments and ovaries, which lie below the tubes. That means inferior means below. Then medial means on the inner side will lie the uterus between the two fallopian tubes. So these fallopian tubes are supported by the attachment to the uterus. The peritoneum folds over them, dripping down below as the broad ligaments and extending at the sides to form the infundibulopelvic ligaments. Then the peristaltic movements of the fallopian tube is due to the action of the smooth muscles. So due to the smooth muscles, this peristaltic movement of the fallopian tube will be done. Then the tube is covered with peritoneum, but the infundibulum passes through it to open into the peritoneal cavity. So these are supported by this fallopian tube are supported by the uterus, the peritoneum folds, then the peritoneal cavity. The next is the uterus. The uterus is a hollow muscular pear-shaped organ in non-pregnant women. It is 7.5 centimeter long, 5 centimeter wide, and 2.5 centimeter depth. Each wall is being 1.5 centimeter thick. Okay, so the function is it will shelter the fetus during the pregnancy. It will prepare this possibility of each month, and following the pregnancy it will expel the uterine contents. Then next is the location. It is situated in the true pelvis between the bladder and the rectum. Then parts of the uterus, it is divided into the body or the corpus, which is a middle portion. Then the fundus, which is the portion above the body. Then the cervix, which is the fundus is a dome's upper wall between the insertion of the fallopian tubes. Then the cornua are the upper outer angles of the uterus where the fallopian tubes join. So this cornua are the angles where the uterus will be joined to the fallopian tube. Then the cavity, it is a space between the anterior and posterior wall. It is a triangular in shape. Okay. Then the isthmus, it is a narrow area between the cavity and the cervix. Between the cavity, which is a hollow portion, and the cervix. This portion is known as the isthmus. The next lies the cervix or the neck. The cervix forms the lower third of the uterus. Okay, then it will continue below with the vagina, and it is divided. Cervix is divided into two parts: the vaginal portion and the supravaginal portion. The vaginal portion is the side which is attached to the vagina. Then the supravaginal portion is the side of attachment of the cervix to the vaginal wall. So this side of attachment is again divided into two: the internal os and the external os. The internal os is a narrow opening between the isthmus and the cervix, okay, above. Then the external os is a small round opening at the lower end of the cervix, so this will lie below. Then layers of the uterus, there are three layers: the perimetrium, myometrium, and the endometrium. This perimetrium is the outermost, myometrium is the middle, then endometrium is the mucous membrane which lies in the innermost portion. Then the round ligaments and the ovarian ligaments, these are the ligaments which will be supporting the uterus. Then the uterus, superior to the uterus lies the intestine. Then inferior lies the vagina. Lateral on the sides it will lies the broad ligaments, fallopian tubes, and the ovaries. Then the anterior portion, then in the anterior in front, it will lie the uterovesical pouch and the bladder. Then in the posterior part, that is behind, will lie the rectouterine pouch and the rectum. Then next is the vagina. Vagina is a passage which acts as a musculomembranous canal situated in front of the rectum and behind the bladder, passing upward and backwards into the pelvis along a line approximately parallel to the plane of the pelvic brim. So this vagina, it will continue upwards with the cervix. Then the structure, the posterior wall is 10 centimeter long, while the anterior wall is 7.5 because the cervix projects at the right angle into the upper part. So this vaginal wall will stretch during the intercourse in childbirth due to the transverse folds known as the rugae. In the nulliparous adult, the vagina is height-shaped in section. So there are transverse folds known as the rugae which will stress during the childbirth or during the intercourse. But in the nulliparous, that means the person who is having no child, the vagina will be height-shaped. Then the functions which it will allow the escape of the menstruation and acts as the excretory duct for the uterine secretion. Then it will receive the semen from the male, then provide an exit for the fetus during the pregnancy. Then the vagina has an acidic environment which protects it against the infections. Okay, the pH is around 4.5. The lining of the vagina is made up of the squamous epithelium, and beneath the epithelium lies the vascular connective tissues. Then superior to the vagina lies the uterus. Then inferior means below lies the external genitalia. The lateral sides, it lies the pelvic. Beside the upper two-thirds are the pelvic fascia and the uterus, which pass beside the cervix. Then in the anterior portion lies the vaginal wall. Then the posterior portion lies the pouch of the Douglas. That means the rectum and the perineal body. Next is the blood supply of the internal genital organs. So in the blood supply, here lies the uterine plexus and veins, uterine artery and uterine veins. Then vaginal artery and vaginal veins will be there. Then the internal iliac artery and the internal pudendal artery. So these are the arteries and veins which will be supporting the which will be providing the blood supply to the internal organ. Then lymphatic drainage. The lymphatic drainage is done by the internal and external iliac lymph nodes. The internal iliac nodes and the superior inguinal lymph nodes. So these are the lymph nodes which are included under the female reproductive organs. Then the nerve supply is done by the uterovaginal nerve plexus and the perineal nerve, or the pudendal, or this is a branch of the pudendal nerve. So these two nerves will be responsible. Then in the accessory reproductive organ includes the breast. The breast is a mass of glandular, fatty, and connective. So the areas which come under the breast are the lobules, lactiferous duct, fatty and connective tissue, areola, and nipple. So, so the areolar cells we can see, which are inside the lobules. So various lobules are there inside the breast. So under this lobule lies the areolar cells. Okay, so areolar cell, or this lactiferous duct it will extend from the areola. Then underneath these lobules and the lactiferous duct, these are surrounded by the fatty connective tissue. Then next we'll see the lobules. What are the lobules? The lobules are the glands that produce the milk. Okay, each breast has 15 to 20 lobes. Then the ducts, these are the tubes that carry the milk from the lobules to the nipples. Then fatty connective tissue, these are the tissues which surrounds the ducts and the lobules. Then areola is a circular area around the nipple. Then the nipple is the center of the areola. The nipple contains about 15 to 20 lactiferous ducts. The function of the breast, we know it is mainly used for the lactation. So these are all about the internal and external genitalia and the accessory reproductive organs, that is the breast. So under the external genitalia we have seen we have the mons pubis, labia majora, labia minora, clitoris, vestibule, urethral orifice, vaginal orifice, and perineum. Then the internal reproductive organs, we have the 2 ovaries, 1 uterus, then cervix, then vagina, then the 2 fallopian tubes. So the functions of the reproductive organs are, it will help in the oogenesis, then copulation, production of hormones, then fertilization of the egg, implantation, then development of the fetus, then also help in the menstruation. Okay, so these are all about the female reproductive organs.